Welcome to another episode of QRA Live with me, your host, Jimmy, the AcuSensei, and coming to you at an earlier time. Um, and we will resume our regular schedule time of 5 p.m. Central Standard Time on Sundays. Before I continue, let me get the chat ready so I can see what questions you have. We go for 20 minutes, and depending on if we have a lot of questions, I typically go overboard, but over time, but I want to respect everybody's time to give everybody an opportunity to ask their questions. So this is a channel, this live meeting is for you to ask questions. We treat thousands of patients in our clinic in Cedar Park. My team is rated as the #1 acupuncture and wellness clinic in the US, in the entire US. And not everybody can come to our clinic. We have many subscribers and followers all over the world, and they can't all fly to our clinic. And so this is the way that I thought that I could give back. And so if you have a chronic health issue that you're struggling with and you are not getting better, or maybe you are getting better, but you kind of just plateaued and you need you need like a second opinion, third opinion, or maybe even a fourth opinion that can help you maybe find the right practitioners or find the right treatments, or maybe you want help to you're like, what can I do at home, right? Because when you go to your physician, they typically don't tell you what to do at home. I mean, most practitioners will tell you, some generic things like, oh, go eat a better diet, go exercise. And that's it. And you're like, what? What do you mean eat better diet, right? There's so many diets out there. Which diet should I be doing? Exercise. Which exercise should I be doing, right? And you're like confused. So they leave you to your practitioners, and especially we see this a lot of Western medicine physicians. They leave you to go Google it yourself. But here's the problem. You go Google it yourself, and then next time with the follow-up, you tell them you Google this and you Google that, and then they laugh at you and they're like, why would you Google? Why would you Google? And you're like, well, because you don't tell me what to do, right? Well, here's the thing. It's not their fault. They don't know what to do, right? They're not trained. Physicians are not trained to tell you what to do at home to take care of your own health. What they are trained to do is to save your life in the case of an emergency. That's what they're trained to do. But in order to uh, achieve wellness, to achieve optimal function, that's not what they're trained to do. In order to keep that, in order to live a life of longevity, or that's not what they're trained to do. Of course, they don't know what to do, right? So that's where you come to clinics or practitioners like myself and my team, where we are focused on helping you restoring function back to your organs and also retraining your body to heal itself again. This is the thing that, even with my sister, she's a physician, she's a Western medicine physician, as well as my brother-in-law. They're physicians. My brother-in-law is a very famous urologist in Germany. Their belief is that as we get older, things just start to break down and there's nothing you can do to reverse it. I don't believe that. And that's not what we do in our clinic. It's not just not my belief. It's not what I've seen in my clinic. Okay. So what we've seen in the clinic, real people, is when they are given the right advice, given the right information, regardless of how old they are, they can still reverse some of the advanced aging. Now, can it stop it? No, we cannot stop aging, right? But can we reverse some of it? Absolutely. This is not my opinion. This is based on facts. This is based on real patients in our clinic. And you can see, and you're on YouTube, go look at all of our testimonials. And we have, we have a few hundred video testimonials of people expressing their organs, getting their organs function being restored, right? So for those of y'all who are tuning in, welcome. I'm just, giving you opportunity to type into the chat what you need help with. Okay. I do need to give a disclaimer. I'm not a physician. I'm not trained to do surgery. I'm not trained to prescribe medications. So anything that I say, advice that I'm giving on this channel is only advice that I have given to patients we have actually seen in our clinic or my team has seen in our clinic. And I'm just sharing their testimony. I'm sharing their case. I am not telling you what to do. Okay. I have to say this because otherwise Google will shut my channel down. Okay. So type into the chat, type in the chat what you need help with, or want me to share with you my QRA, right? Quick restorative acupressure, right? Okay. Someone moderate trans time reaction. Okay. Yeah, if you want me to show you my QRA, quick restorative acupressure, if you've been watching my reels, you've been seeing that, I do a lot of reels, right? Yeah, okay, great. I'm gonna jump in because I've only got about 14 more minutes. Okay. Ricardo Sanchez, thank you for joining in. I think you're new. I haven't seen you. GERD and dry eyes. Okay. Gastroesophageal reflux disease. That's what GERD stands for. Okay. And basically, it's like acid reflux, right? And a lot of times with acid reflux, it's worse after you eat, right? It's worse when you lay down flat, and it's worse at night, right? And you'll notice people who have GERD for a long time, they'll notice they cough a lot, right? Because it burns your throat. And when it burns your throat, when the acid comes up to your esophagus, it's not your trachea, it's your esophagus. Esophagus is the part of your digestive tract. And when it burns that part of the digestive tract, your body, is getting burned, so it secretes mucus and it swells up, right? And when you're and that mucus is forcing you to like cough, right? Okay, so what can you do? So GERD is so your stomach, okay, if you have, moving back just a little bit. So here's my ribs and it comes up to here. So my stomach is literally about right under the midpoint of my, well, actually right under my diaphragm, right? And so it's right about here. So your stomach is typically right about here, right? So I'm coming up to the ribs right here. So it's right here. So what you can do, this is a strategy I love to do. It's called draw the line, okay? So if your stomach is right here, right? You can see I'm just going to go like this. So my stomach's at this level. I'm just going to draw the line, draw the line, draw the line right here, right? So stomach right here, draw the line right there. Okay, so right here, this part of my arm, okay, these nerves right here, they are connected to the stomach. So if I stimulate the nerves here, it will stimulate blood circulation to here and the nerves to here, which is where my stomach is, right? And so what I'm going to do, so again, here's the stomach. I'm going to draw a line, okay? Draw a line to here, and this is about this area. It's about this area, and it's a big area, okay? It's not just exactly just this line. It's this big area. I'm going to press, okay? Now, mine really hurts right now because I was doing some weights, and so I'm sore from weights. But if you find when you draw the line and you find this area, you're going to push on it, right? Push on it up and down. You're going to find the most tender spot, right? And this spot typically will be tender with people who have GERD, okay? Even when you go in the inside, you're going to go in the inside, you're going to push. This spot right here will also be tender. Whatever, you're going to have multiple tender spots. It's not just one. When you find a tender spot, you're going to dig in, okay? Now, for Ricardo, for you to know if this works for you, what you need to do is when you start having that burning sensation, there's two times you can do this. When you have the burning sensation, go to this area, find the most tender spot, and push really hard. It's got to hurt. This has got to hurt right here. Push really hard for 30 seconds. Okay, start off with 10 seconds. 10 seconds and see if that reflex, if that burning sensation goes down. Okay, if it decreases. If it doesn't, go around the other, you can go all the way around the arm. and all the way around the arm and find the most tender spot. Keep on finding another tender spot, push it for 10 seconds, and the burning sensation should go down. Now, this is my QRA is quick restorative acupressure. So quick, it works quick. So if you push a spot and the burning does not start to decrease, it may not go away 100%, but I want it to decrease at least. If it doesn't decrease at all, switch to another point. Okay. I want instant decrease. That's why I call it quick restorative acupressure. I want quick decrease. Okay. Sometimes it might go away, but at least it needs to decrease in intensity. If it doesn't, find another spot. Okay. So that's the first time you do it. First time you do this QRA is when you actually have the burning. The second time you do it is typically, like I said, before you go to bed at night. Typically people who have GERD, actually there's 3 times. Typically before people who have GERD, they, when they lay down, when you lay down, you start getting it, right? Because you get the reflux coming up. So I want you to find the tender spots. Okay, do this for about 5 minutes. Just find tender spots, press it down for 30 seconds and then massage it. Find the next one, 30 seconds. Okay, press down, 30 seconds, massage it. Do this before you go to bed, and then pay attention. That night when you sleep, does the GERD is the GERD better? Is it less burning, or does it not burn? Okay, so that's the second time you do this. The third time you do this is before you eat. So before you eat, you press this, okay, and see when you eat, does it stimulate the acid reflux? Okay, so that's for GERD. Now, here's the beauty of this, of my QRA. You said dry eyes, right? Dry eyes. It's this area is going to hit 2 birds with 1 stone. This area, your elbow area, is also the area for your eyes. Okay, it can help stimulate secretion to your eyes, because if you imagine, okay, this is my arm. This is, let's say, my top of my head. Okay, then this is the top of my head, and then this elbow area is going to be this line right here of my eyes. So it's the same area. So you got lucky here, where your stomach, and the area that stimulates your stomach function, and it stimulates the secretion of the tears in your eyes, is also the same area. Okay, so you want to fine. Now you can go up here too. You don't just go below here. You can go above the elbow. The elbow area is where you're same as your eyes. Okay. You can do both elbows. So if this elbow doesn't work, use your other elbow. Okay. One of these elbows will work. If the elbows don't work, hey, I've got 100 ways of you to do this. Okay. It's not just one way. This is why QRA is different from acupressure. Acupressure, that most practitioners, especially acupuncturists and Chinese medicine practitioners, what we were taught in school, it's like, oh, this one point is for hypertension. This one point is for hypertension. Okay, I do that point for hypertension, but it doesn't work. Then what? Right? Then you're out of options. With QRA, which is different from acupressure, I have hundreds of ways to help you. Okay, so I don't want to give you too many ways, because I want you to be able to remember them. For you, Ricardo, I just want you to focus on your elbows. Elbows for you. Okay, I could use your knees as well, but elbows. So all up and down your elbow. So I would say about here. See, so that's about 1, 2, 3 inches up, 3 inches, 3 inches down from your elbow, and 3 inches up from your elbow. So from this section, this whole section all the way here, you can look for tender spots. You can look for tender spots all over. Okay, even all the way into your biceps, your triceps. Okay, biceps down here, all over. Find those tender spots for your dry eyes. Okay, for your dry eyes, your acid reflux, your GERD. Okay, press all over these. Okay, now this will help you. Okay, since Ricardo's the only person that listed something, so I'm just going to continue to focus on Ricardo's dry eyes and GERD. So now, information. You need the right information. GERD. why do you have GERD in the first place, right? So obviously diet is huge. If you're eating a lot of fatty foods, you're eating a lot of protein, these days people are just like, oh, you need to eat so much protein, which is true. You do need to eat protein. But like people like eating the carnivore diet, the paleo diet, they're overdoing their protein, and that can cause acid reflux. It causes inflammation. So when you put a lot of things in your body, food in your body that generates inflammation, that can also irritate your stomach, which can cause the acid reflux and the GERD, right? So in order to fix it, is stop adding fuel to the fire, right? Because and this is how you can test, just go vegetarian. Go vegetarian for 1 week and see if it helps your GERD. If it does, then that means you're eating way too much animal protein, right? So that's one possibility. And there's many possibilities, right? Another possibility that people are going to tell you, especially functional medicine practitioners, they're going to give you some hydrochloric acid, stomach acid, pepsin, right? They're going to give you some pepsin. The reason why you're having acid reflux is because of a low acidity. Okay, so they're going to give you enzymes to increase the acidity. That helps temporarily. It doesn't fix the problem. Okay, so as a supplement, it helps. It's kind of like a Band-Aid, also like medication. So giving you pepsin, hydrochloric acid helps. It helps you digest, it helps your stomach, okay? But it doesn't fix your problem. You have to stimulate, reconnect your brain to your stomach. The problem why your body's not producing enough acid. Now, this is if your body's not producing enough acid, okay? If your body's not producing enough acid, one could be there's damage to your stomach cells that secrete the acid, right? So you need to nourish those cells to help increase the acid. You also need to stimulate your brain to heal your stomach again. Taking a supplement does not stimulate your brain to heal. Okay. What you need to do is you need to reestablish the way that your brain heals, controls the healing of your stomach is by the nervous system. It's connected through a nerve. So you need to reconnect that connection, right? It's just like if you are arguing with your spouse, if you're arguing with your spouse, well, if you don't talk with your spouse, all right, does your relationships get better? Does your relationship get better or worse? It gets worse, right? So how do you mend? How do you mend that relationship with your spouse? Well, you mend it by having more communication. That's the same with your organs. I hope this makes sense. I'm trying to use the analogy that I use with our patients in our clinic. So by increasing the communication from your brain, which controls everything in your body, increasing your communication from brain to your stomach, that is the only way to restore function, right? Now, you need nutrients by taking capsules, supplements to stimulate, more acid. You need some nutrients. You also need nutrients. You need some probiotics, right? You need some prebiotics, right? You need anti-inflammatory foods. Those can all help nourish your stomach. All right. There are foods that can nourish your stomach as well. Papaya can nourish your stomach, right? So if you eat papaya, it gives you digestive enzymes. It also gives you other nutrients to help nourish your stomach because your stomach needs to eat as well. Okay. So now how does it eat? It eats through your bloodstream. Now, so how does the nutrients get to your stomach? Breaks the food down, then it goes to your large intestine. Okay. So the nutrients aren't immediately getting absorbed into your stomach. So they go down your large intestine. So like your stomach breaks down the food, and then it goes down your it's not a large intestine, small intestine, and then it travels all the way in your small intestine to your large intestine, right? It has to go back to your stomach. How does it do that? It does it through your circulation, your blood circulation. Okay. So if we do two things, move blood to your stomach, which is the QRA, right? Quick restorative acupressure. In our clinic, we do quick restorative acupuncture, which makes it faster. But if you do QRA at home, so you can move blood to your stomach, the blood contains the nutrients that you just ate from the papaya, and it moves it to your stomach. Okay. So that's one thing. You're bringing nutrients to your stomach to nourish it. The second thing when you do QRA is that you're reestablishing the connection between your stomach and your brain. So now your stomach and your brain have better communication. The more communication it has, guess what? it starts to it retrains it. It's telling the stomach, hey, stomach, the brain is telling the stomach, you're supposed to be secreting this amount of acid. You're supposed to be breaking down the food. You're supposed to be, the acid is not, you're supposed to be producing more acid so the acid doesn't go up. So it keeps telling it until it sounds like a broken record. And then when it sounds like a broken record, your stomach starts to do the function again. It gets retrained. And guess what? Then you don't need to take the supplements. You still need to eat the right foods, right? But once your stomach is retrained, it goes back to doing what it was doing 10 years ago, right? Think about it. When we were a kid, when we were younger, and our bodies healed this fast, right? Because the body knew what to do, right? Now, we can't restore your function back to when you were 10 years old, but we can restore it back a few years, maybe 5, 10 years when it was functioning better. That is restorative longevity. All right, guys. Thank you, Ricardo, for the question. I love it. Thank you for sharing. If it's your first time, welcome. Get your friends and family. Next week is going to be Sunday. We're going to be back at 5 p.m. Central Standard Time, or 5 p.m. Central Standard Time, okay, or it's 6 a.m. Taiwan time, 5 p.m. Central Standard Time on Sunday. All right. I'll see you next week. Thank you for joining. Peace.